Thank you, Kylie, for that. And I don't know where Jim Mills is in the room, but for those of you who heard him speak last night, I feel very similarly. I can get up in front of a huge group of people professionally, not be nervous, and talk. And every year when I get up in front of you all, it is one of the most emotional days of the year for me. So we'll get through the hard part of this presentation, I think, first. And then I'll go through sort of just a quick high-level overview of what the CureOM program is, kind of guide you a little bit about what to expect this weekend, and then get you on your way to start the day. So with that, let me start with just guiding for a minute. I hope you all received these booklets that Lauren put together, which are so beautiful. In the past, we've had folders, but I think these are just phenomenal. So I just want to alert you to a few things. So the agenda is in the front, and we have 3 tracks this year. So we have what we're calling a medical research track, and then 2 mindfulness tracks. And we really want to leave it up to all of you where you want to go, where you want to be. And really our philosophy at this meeting is that you're on your own directed tour of the weekend, and to remind you that sometimes that means slipping away and taking a nap or taking some time to yourself, because depending on where you are in your journey, this can be a very overwhelming emotional weekend. And so please take care of yourselves, do what you need to do, come and go as needed. You've seen the staff in the room. Come to any of us if you have any questions, if you're struggling with anything. And we also have Thomas Jefferson University social workers here with us, which we're thrilled to have. And I don't know if you guys want to stand up, and also just so you all know that they're... And we'll talk a little bit more about some of our collaboration with them in a few slides, but they're a huge resource. They've been with us at these meetings every year for, I think, the past 6 or 7 years now, and you know, have an understanding of what's going on and can be a huge resource. So I think that's sort of the guide for the meeting. So maybe I'll just redirect to my slides. So I am a trained internal medicine and public health doctor standing before you. So ocular melanoma is not my clinical specialty. And this is where I get emotional every year. I came into this field much like all of you sitting in this room through a personal connection. So I want to take a moment to introduce my co-founder of CureOM. So this is my husband, Greg. My best friend, and many of you got to meet him. We founded the CureOM initiative together. So Greg was diagnosed with ocular melanoma in 2006, and at the time, nothing existed. There were no websites, there were no Facebook groups, there was nothing. And Greg and I started keeping a blog just to inform friends and family. My sister set it up for us to kind of manage our friend and family community around his diagnosis and treatments. And people started following our blog. People from the ocular melanoma community started following our blog, people we had never met. And as we were advocating for Greg, which we did a lot of, we decided that it was up to us. We needed to turn that advocacy we were doing at a personal level and advocate for the community and advocate for those people who were following our blog, because they were following our blog because there was nothing else to look to. And so we really started turning our attention, not only advocating for Greg and the next treatments that he would have, but really thinking about the community at large. And a year after he was treated with the plaque, we found out that his disease had spread to his liver. And we were told he had 6 months to live. He was 35 at the time, I was 30, just starting our lives together. And I remember at the time, it was all phase 1 clinical trials, and so he was on some phase 1 clinical trial, and I was probably post-call from working in the hospital overnight, and we were sitting in the infusion room late at night. We were the only ones there, and his doctor, Jeffrey Shapiro, who was the head of the phase 1 clinical trials group at Dana-Farber, was so dedicated to us. And we looked at him and we had all the hope in the world. Greg was going to be the first patient to be cured, and we were going to find the phase 1. And I believed it then it would be Greg. It wasn't Greg, but I believe that it could be someone in this room. I still have that hope. And I'll tell you why as we go through these slides. And Dr. Shapiro said to us, we said, we hadn't thought about this, but what if this drug doesn't work? And we were coming up on scans, and Jeff said to me, the ocular melanoma community needs to come together. Like, there's no organizing of the research community. There's no organizing of the patient community. You got to look at what lung cancer's done. You got to look at what breast cancer's done. Look at how they've organized their communities. And so we thought, okay. So those late nights, Greg would be sitting in the infusion chair, getting that, poison, that hopeful poison, into his veins. And as the caregiver, I felt like I was just sitting next to him, and I was on my computer and trying to pull those things together from that little spark that Jeff Shapiro left in my brain that we had to organize, we had to advocate. So in 2009 and 2010, we held our very first international patient and research meetings, thanks to a number of my mentors who believed in the cause and gave us space at Harvard and Dana-Farber, where I was training at the time. And so you'll probably see my sister and my parents here at this meeting, which at this meeting seems sort of like in the background, superfluous, chasing around my daughter, which is awesome, and they're very much needed. But in those days, they were stuffing folders. They were planning the meetings. They were the ones you were talking to. They were the ones greeting people and organizing everything. So a lot has changed since that time, and I think Greg would be extremely, extremely happy and proud, and there's so much hope in the community and so many resources, and you all are a part of that. And so I'm going to read just a little excerpt from Greg's speech at that very first meeting 10 years ago this fall. And then I think I'll get less emotional and we'll go on through the presentation, which is relatively short, but I just thought I would give you a quick little high-level tour of what CureOM is for those of you who may not be familiar. And if any of this clicks with you and you want to know more about it, then you can come up and talk to any of us or check out our website or make suggestions if something that you think you need we don't offer. So this is just an excerpt of what Greg read at the very first patient meeting in Boston. And apologies for being emotional. I remember first being diagnosed 4 years ago, and I remember feeling terribly alone. And over the years after my initial diagnosis, I remember countless times when I felt alone. I would speak the words ocular melanoma to my friends and others and was typically met with reactions such as, "What's that?" or "I've never heard of that," or just silence. Possibly the same reactions I would have if someone talked to me about ocular melanoma before I was diagnosed. Coming into this weekend, things do not seem so rare to me, so unknown or so foreign. Instead, I feel at home and so comfortable in so many ways. You understand. We understand. With this meeting, the series of doctors' meetings that have now taken place, and the new collaborations these treatment providers and researchers have formed, I feel ocular melanoma is becoming bigger and receiving more attention. It may still affect the same amount of people per year, but in many ways it feels to me that there is a momentum, an energy, a connection and community building amongst treatment providers and all of us. This community, this coming together, not only feels so wonderfully supportive to me, to all of us, but honestly, I feel in the end, this is what it's going to take to put an end to this terrible disease and find the cure. So with that, I want to just talk a little bit about CureOM, some of our patient resources, some of the research activities that we're doing, and then we'll jump into the program. So as I mentioned, Greg and I were advocating in those early years, and what we ended up doing was taking those advocacy activities that we were doing and we put it into the founding of CureOM. And I think the Melanoma Research Foundation, which is the largest independent melanoma organization in the US, has been a real leader in this, acknowledging rare subtypes. And when none of the other large melanoma organizations were acknowledging ocular, the MRF said, wait a minute, there are these rare subtypes and they're important and they need attention and the patient community needs attention too. And so I think the MRF has been a big leader in this. So we modeled the CureOM's mission off the MRF mission, which is to support research and accelerate the development of effective treatments and ultimately a cure for ocular melanoma through innovative strategies, including international and interdisciplinary collaborations, and to improve the lives of people affected by ocular melanoma by creating systems and programs to provide education and support and to advocate for the ocular melanoma community. So I'm going to go through, like I said, high level of some of our programs and works that I hope show how we've held true to this mission. So here's a list of a number, I don't even think this is an exhausted list, but a number of our patient and caregiver initiatives, and the ones that are highlighted, I'm just going to sort of talk through quickly. So we're starting with the Eyes on a Cure annual Patient and Caregiver Symposium. You're here, you found it. This is really the backbone of our patient education and support, I would say, every year coming together. We move the meeting around every year. This is where we've been. And we find that it's important to move the meeting around, number one, to connect with different providers, different academic centers, help bring people together at the centers where we hold the meetings, and then also to make it more accessible to a wider range of people across the country, because we know how hard it is to travel and with cancer and all the financial burdens, so we want to move it around to make it accessible to more people. And so, we'll have a survey at the end of the meeting, but every year we take your feedback and make changes, and every year we hope we're better and stronger than the year before. You've already, Kylie talked a little bit about this, but MRF has a number of print resources. Kylie mentioned how to get them, and she already held this up, but I'm going to hold it up again because this has been a long time in coming, and if we had it in 2006 when Greg was diagnosed, our lives would have been very different at the time. So we're hoping that this will be ready to ship out in May. We just had the focus group on it, got some great input from a number of patients. Thank you all for contributing to this. Curo brochure, we have a number of different materials and free to you all, and then to any treatment centers if you're talking with your doctors and they think these would be helpful in their clinics. Sometimes we hear that treatment centers have educational review boards who need to approve everything, and then if it's approved, it gets co-branded. And I just wanted to let you all know that we are totally open to co-branding and often leave space in these materials for that to happen, because we know that that is a request at many treatment centers. Just an example of some education and awareness campaigns. Some of you may be aware of the I Get Dilated campaign that we run every November. These are a couple example images. Adam and Lauren really spearhead that. I think do a phenomenal job. This past November, they expanded the reach from the year before. So talk with Adam and Lauren if you want to get involved with that awareness campaign. Support groups. So as I mentioned, the Thomas Jefferson University team has traveled around the country with us to these different meetings and helped lead support groups here. And we've always gotten really amazing feedback about that time. But we've also gotten feedback that it's not enough once a year to get that support, and that when we all go home to our home centers, there aren't necessarily ocular specific support groups, and sometimes it just doesn't feel quite right to be in a general melanoma support group when the issues are different. So we piloted a couple years ago this idea of, well, could we do virtual support groups throughout the year, in person at the annual meeting, and virtual throughout the year? And so in partnership with Thomas Jefferson University, we now hold virtual support groups, and they've been growing, and there's an educational component to it, and support groups are divided into primary, metastatic, and caregiver sessions. So please talk to the TJU team or Lauren for more information about the support groups. We also have it on our website. MRF Galas, I think Kylie mentioned these a little bit. This is a way that we're able to honor dedicated people in the community. This was a gala in Philadelphia where Dr. Sato and Melissa Greenhut were honored. Carol Shields had been honored the year before. And it's really amazing to be able to honor the community, to raise needed funds for research. It really brings the community together, and we have a number of galas around the country. The two most upcoming ones, closest in date, are the Denver Gala coming up May 2nd and Philadelphia June 6th. And at all of the galas now, we also have a Curo Vision of Hope Award. And so you have a few people in the room who are past or current recipients of these awards. So as you're talking to folks, you can try and pick out in the field who that is. something to get involved with. We also have Miles for Melanoma events around the country. These are 5Ks, and many of you have been strong supporters of CureOM teams in your cities, and I think this is a great way to raise awareness. It has certainly been a phenomenal way to raise funding for research, for the registry, and for our program at large, and we are so grateful to all of you. And this is a list of this year's events. You can also find this on our website. And if there is not a CureOM team in the city where you live and you would like to start one, please talk to us. I'd also like to point out that we have a few folks in the room, at least two, Linda and Bernadette, but there may be others, who said, there's not an MRF event in our city. We're going to start one. And they have been phenomenally successful in what they've been able to do. And so yeah. So basically, if you don't find what you want to do in our smattering, let us know and we'll support you in doing something that you want to do. So I'm going to just briefly tell you about a pilot initiative that we've launched. This is bridging sort of the patient needs and the research, and then I'll go quickly through research and we'll move us on. So this is something that we've been hearing in the community for a while, and I think this article that came out a year or two ago, it was sort of the straw that broke the camel's back for us. This was an article published out of UCLA, Dr. Tara McConnell there, and a psychologist with whom she works, that basically showed ocular melanoma patients in clinic were not having their psychosocial needs met. And so together, that information coming out of UCLA, along with a lot of discussions that we've had with nurses and social workers and other frontline staff in clinical offices, led us to pilot what we're calling the Treatment Center Collaborative Coalition. And so in this first year of this pilot, we have 7 participating centers, which you can see on the slide. We are meeting regularly with nurses, social workers, case managers, front office staff, bringing them together. We have an educational program that they decide what they want to hear about. We bring in speakers for the conference calls, have some discussion about that educational topic. And then they ask to just have time to talk and troubleshoot. They say that as frontline staff members, they're not going to the research meetings. They're not meeting each other. And they want to know how best to support you all. And so this opportunity is giving them a chance to get updated on what's the latest in the OM field, what's the latest in terms of patient support and resources, and then to just share and discuss to help them be better caregivers for you all. So this is a pilot initiative in this first year. So far, it's going really well. We've had our first 2 meetings. People seem very enthusiastic. And if it goes well, we'd really like to expand this beyond these 7 centers. So briefly to go through research initiatives, Kylie went through some of this, so I won't belabor too many of these points. I will mention that this is a quote from Greg's talk at our first scientific meeting, and I think that a lot of our research initiatives have really been built around this vision that he describes here. We want a team of experts to focus on ocular melanoma. The more minds we can bring together to look at OM, the better result we might have. The team, Greg was an organizational psychologist, so you'll see this throughout what he says. The team, no matter what academic halls they walk, approaches they use, research they are pursuing, are willing to collaborate, push the limits, take risks, think outside the box, be aggressive yet safe, be passionate and integrative. And so one of the ways that we're trying to bring the research community together goes all the way back to 10 years ago. What we first did was just to bring people together and literally have people in the same room and sharing their research and talking about collaboration. We get a lot of feedback about new research projects and new initiatives that have come out of these meetings because people are brought together in a collaborative way and can follow up with collaboration. So these last 2 images are scientific meetings we've actually had in the past 6 months. We have a partnership with the Society for Melanoma Research Congress, and we held an all-day CureOM science meeting there with over 60 participants from around the world. And then we had a follow-up meeting in January in partnership with MD Anderson. This is a peer-reviewed journal article that we published out of one of our meetings a couple years ago that was in partnership with the Society for Melanoma Research Congress and the National Cancer Institute. So we are publishing even just out of the meetings themselves. Ideas are coming up or summarizing the field, et cetera, coming out of these meetings. Another recent publication that I want to talk to you about, switching gears slightly, is a recent publication that came out of the Cancer Genome Atlas Project. And this is, without going into too much detail, this is a big initiative of the National Cancer Institute where they are characterizing cancers from a molecular biological level. And they had limited space for rare cancers. We were able to advocate, sort of do the unthinkable, and I think we had a 6-week window where we had to get 50 tumor samples to the NCI from all over the world. If you've ever done that before, it's sort of impossible, and I think they counted us out, oh, uveal melanoma won't be included in this. Well, we did it. And so we got uveal melanoma to be one of the rare cancers included in the NCI initiative, which means that it's getting complete and comprehensive molecular and biological analysis alongside all of the big cancers. And so some of the publications, these data are public, and some of the publications from the initial research is now coming out, and this is one of those articles, and this is a blog on the National Cancer Institute page that talks about patient advocacy and how it can affect research. I won't talk about the research grants because Kylie already did. And then just a note to say that the registry, launching a global patient-reported registry, is an initiative that we have been working very hard on. You'll hear more about that in a later session. And just to let you know that we had hoped to have some information to share with you today. We can't share specifics, but we do want to put a little tickler out there that in the coming weeks, we will be announcing a big, great, new innovative partnership with the registry, and just really a transformational gift announcement that is going to allow us to move forward like we haven't been able to before. So stay tuned. And then we still have lots to do, but we are in a very different place than we were when Greg was diagnosed in 2006. And there is so much hope, and there are so many dedicated people in this room working on this disease. And it's I just have hope, and I know that the next person who will be cured could be in this room, and maybe one of you. So I maintain that hope, excited to be here with you this weekend, and I hope it's a beneficial and helpful weekend for everybody. Thank you.